Hi there, it's Rena from Rena Davis Wellness, and this is a little segment about back care. So I know that a lot of folks right now are feeling a little more low back pain, likely from sitting a little bit more than often or not sitting in the normal ergonomically correct positions while we're working and a variety of other reasons. So I want to just give this little video, but first I'm going to talk about why you might have low back pain and what to do about it long term before we get into a little bit of the short term work that we can do to just kind of ease it a bit. So a lot of times when we have low back pain, I'm just going to turn sideways, we are hyperextending our spine. So right now I'm a little bit hyperextended actually, but if I were to really curl up, you'll see that exaggerated, right? So this is a hyperextension of the spine. We see this a lot with folks who wear heels when they're up and their butt sticks out a bit. And then you have the opposite, which is taking that whole curve out of your back. And then you have that natural curve, which is around here. So to keep that natural curve, we need to have nice, tight abs, conditioned abs. We also need to have nice tight glutes. So those two things work in one way. We get stronger here. And then the other thing that's happening when we are curved this way, the hip flexors are tight and the low back is tight. So if you can imagine a little X on your hip, across your hip, we have weakness one way and we have tightness one way, right? Sorry, I did that the wrong way. Tightness this way and weakness this way. So in order to fix that up, of course, you need to strengthen the abs and glutes, and you need to start lengthening through your low back and your hip flexors. So hip flexors get tight when we're sitting a lot, right? You can imagine, and you can see what happens to the curve in my back when I sit a lot. It's going to straighten out. And you can see, of course, what I showed you with the heels, and we lift through the glutes because we're tilting. So in order to really address that issue long term, of course, you need to get that strength and that opening across certain parts. But let's address just the short term work. So I'm going to bring the laptop down so that you can see what I'm doing down here. So I have with me just a rolled up towel, and this is a really useful tool. And the first thing I'm going to do with this rolled up towel is lay on it from the length of my spine. I'm going to move the laptop back so you can actually see. Let's shift some things here, pardon me. There we go. Okay, so rolled up. We take it right to the base of the spine, and then we can lay across it. Now you might be thinking, how's that helping my low back? Well, one thing that's happening right now is we're tilting one way. We're also really opening up the shoulders to let the upper back muscles relax. So that's another area that we get really tight. I'm not totally addressing that right now, but it is a really nice position to lie in. So if you're finding that your pelvis is constantly in one direction from sitting, right? Because we're like this all the time, this will help you to release in the other direction. And you can lay there for quite a while, as long as you like, really, because it's not going to hurt you at all. Position 2 with that towel is to bring it across this way and to lay across it. So you're right at the very tips of my shoulder blade. So my shoulder blade ends here, and then we lie across. Again, this is more for your upper back. So if you're finding you have tightness in your chest and you're really tightness in your chest and you're loose, don't have enough strength in your upper back to keep you open, this is a fabulous place to be, and you can again lay here as long as you like. But I'm going to show you the third option. I'm just going to lift my hips right here and take this down and lay my sacrum. So the sacrum is that triangular bone that's right at the very base of your spine, and I'm going to sit my sacrum on this. And what that's doing is tilting the other way. So if you can imagine that your back is pressing into the floor when you're in that pelvic tilt position. This is kind of like that, except I still have space under my back. I can put my hand under there. But it's letting the spine just kind of slowly release and letting it be. And it'll also just slightly bring you out of that hyperextension. Remember, the hyperextension is this one. It's going to just bring you out of that a little bit and allow you to settle into this position really restfully and without the use of your muscle. While you're here, if you're experiencing some low back pain, you might want to pull a knee to the chest, and you can hold under or over, that's up to you. And just breathe deeply. And then let's extend that leg up. So it doesn't have to be completely straight. You can have a bend in that knee. If it feels better, you can straighten it out, but don't worry about it. It's really not necessary. We are trying to work through our low back right now, not our upper back. So I want you to again, actually I didn't ask you before, but place a hand under there. And if your back is pressing right into the floor, I want you to take this towel and move it away and get a natural curve in your spine. So I'm going to attempt to show you that. So right here, I can fit, some of my fingers under my back. This is a natural curve. I can't put my whole hand under there, but I can fit a few fingers under, or the tops of my fingers. If I'm pressing this way, I hope that you saw that. So I went from here. You can see that I'm lifting my pelvis a little bit. I'm pushing my spine into the floor. So it's really, I can't fit anything under there now. And then the other way would be that hyperextension, which I hope you don't have while you're laying here, but you might. If you're used to being in that hyperextension all the time, you might have it here. So if you're finding I can slide my arm under there now. If that's where you are, you need to get a tilt in your spine and come into a natural curve so you can feel the tips of your fingers under your back, but not more than that. And then let's hold that. So you're going to hold a little bit of tightness in your belly and then take that stretch. And you can push your leg into your hands and just firm up there. And breathe. And again, you can see that my knee is bent a little. I don't need to straighten it out. That's not necessary. And then let's bring that leg down to the floor and take that to the other side. So again, feel in and just have a little bit of tightness in the abdominals. Feel the low back. Make sure it didn't shift away. And then press your leg up to the point where you can still feel that curve in your spine. So wherever that is for you. We're breathing the whole time we hold here. And really, you can hold this for, you could hold it up to a few minutes if you wanted to. I don't know that you want to, but try at least for 30 seconds. A little bit longer would be better. And then let's take the feet down and just relax them to the floor again. I've got that towel under there. I'm going to move. And I'm going to just take my arms out to the sides. And then I'm going to bump my hips. So I'm going to lift my hips a little bit and take them over to the right. And then let my legs settle over to the left. And as I do that, you can hinge over onto your hip, of course. You could place something, and I'm just taking that same towel and placing it between my knees. And you might look over to the other side. So this is going to get into your QL muscles, your quadratus lumborum. It's going to get into your obliques a little bit. It'll also get into the hip. And we relax into that. And again, you can hold it pretty much as long as you want to. And we're just twisting in the spine gently. That's why we bumped our hips first, to get that more gentle twist when you're feeling a little pain in your low back. And I'm not talking about really severely acute pain. I'm talking about some achiness in your low back. This is helpful. And then I'm going to just keep that towel between my legs as I come up, just for ease. I'm going to take my hips back to center and settle there for a moment and just feel into the back again. Notice once again, you've got that little bit of a curve in your back, that natural curve. And then I'm going to take my hips over to the left, and I'm going to drop my knees to the right. You might be looking over at your opposite hand, if you like. The other option is to look straight up at the ceiling. If you experience any pain in your cervical spine up in your neck while you're doing this, then you look straight up. Well, let's bring the knees back up to a neutral position. I'm going to take that towel and move it away from me now. And I'm going to take my hands up. So you could be doing this just with your hands or on a wall. So what I'm going to do right now, if you were at a wall, you could push your feet into the wall. I'm going to push my knees into my hands and just hold there. And I'm going to keep that curve. So I'm using my hands to block my knees from pushing in, but I'm going to keep that curve in my spine. My belly tightens up when I do that, so we're strengthening through the belly. And then we release. So the release doesn't look like much. So if your feet are on the wall, it's just helping you to hold them there. You're still going to push your knees into your feet. Or you're not pushing your knees into your feet, your hands into your knees. And do that a few times and make sure that that natural lordotic curve is still there as you do that. So when you do this, you might be tempted to come out and push your spine into the floor. I don't want you to do that. Just let that natural curve be there through all of these movements so that we're training our backs to act the way they're supposed to act. Oftentimes as well, when we come into, or when we're experiencing a little low back pain, we have some pain through the hips. So if you think about all the parts that connect to your low back, they're all going to be affecting it. So, and if one gets tight, others get tight as well. So I'm going to come into a figure 4 pose. So this foot on top is going to flex. It's going to be active while you do this. And we're going to lift. We can take the hands around the knee. We can use the elbow. I want you to be really cognizant of where your knee is in relation to your hip. So sometimes when we come to this, we start to move it in towards the center. Bring it back out so it's right in line with your hip. Keep this foot flexed, and you can hold and just breathe. If you're not feeling anything right here, you could have, of course, come a little closer. Just keep looking at that knee and making sure it's staying in position. And the only reason you're doing that is not for safety, it's just to make sure that you're getting a nice effective stretch in your glutes and in your hip. And then we can release that and do that on the other side. Remember to flex the foot, bring it in to the point that feels good. Keep breathing as you hold this. Remember to check the knee alignment with the hip. And then release them down. I'm going to take my feet apart a little bit, so they're a little more than hip distance apart, so I can take my hands down and touch my heels. And I'm just going to windshield wiper side to side, just to relax those low back muscles. I don't have to go all the way to the floor, but I can. So if you want to, you could come right over and hold in position there. That's an option for you. You can do that again as many times as you like. These are not exercises that you really need to limit a lot. And then point the knees up to the ceiling. I'm going to turn over. So I'm going to come onto my hands and knees for a moment right here. And have a look at your own spine, if you can. And make sure that you're not like this, you're not like this, that you're nice and firm. So that means your belly is firm, your knees are right over, or under, your hips, and your hands are right underneath your shoulders. Breathing. And then we're going to do some cat-cow. So as you move into a cow pose, you lift your sitting bones up first. You can see my spine arched when I did that. And then we're going to keep moving through until the head lifts. And then come back the same way. So start with your tailbone. Start to move the spine, moving along, and allowing that head to be the last thing that drops. The reason I'm doing it this way as opposed to the usual way is to ensure that your low back is getting involved in all of this movement. My hair is falling everywhere. And I want you to hold in that cow position, letting your head release, you're rounded in your upper back, and then come into a child's pose with that rounded spine. You can settle into your child's pose right there, or you can keep moving. I'm going to move upward, so I'm going to keep that round as I move upward, and then I'm going to again come out of that to move into cow very slowly. And as I take that cow pose, I'm going to again hold right here with this super arched spine and then settle into child again. So when you settle into your child in this position, you can see that my back is still arching a little. I'm still getting lots of movement across the whole spine. And then we come out of that, or you can hold if you like. Coming out, we go up again into cow pose, and then you can keep doing that back and forth as many times as you like. So I hope that this is a little bit helpful. It helps you with a little low back pain or discomfort. And I am about to also record a short session on self-massage, so I hope you can join me for that.